Hi, welcome to the pharmacology part. I'm Amsalu. Today we are going to see some part of the cephalosporin drugs. They are a part of the chemotherapy. When we go to the general feature of the cephalosporin, many are absorbed readily after oral administration, while some are administered parenterally, excretion primarily by the kidney, dose adjustment in the renal insufficiency, probenecid slow tubular secretion. Several cephalosporin penetrate into the CS in the sufficient concentration. Across the placenta, relatively good penetration into the aqueous humor, but in a poor in the vitreous humor. When we come to the generation of cephalosporin, they are majorly classified into the four type of generation. In the first generation, they are listed above the five drugs. From those have cephalexin drug, have been those in cefadroxil, cefazolin, cefapril, cefdrin. They are some part of the first generation. Most of them are readily absorbed in orally, and the cefazolin and cefapril have been absorbed in IV. The half-life of this drug are relatively good. They have been 0.7 in hour up to 2.5. Most of them are excreted in the renal excretion. 70% up to 100% of this drug generation is excreted in the renal. Second generation of the cephalosporin drugs are they are mostly absorbed in parenterally from the oral. Cefaclor been absorbed in orally, cefamadol, cefametazole, cefonazid, cefotetan, cefoxitin, cefprozil, cefroxime. uh, they are administered in the parenterally except the cefprozil and cefproxime, azilate, and lorazepam are being just absorbed in orally. The third generation of this generation of the drug is cefdrin, cefpim, cefixime, ceforaxine, cefotaxime. Some of the third generation of this cephalosporin. As you look on the display part, you can see the half-life, route of administration, and renal excretion. Classified in four based on their spectrum of activity. When we are revising the first generation as I'm listed above. The first generation of cephalosporin is active in vitro against gram-positive cocci, including penicillinase producing and non-penicillinase producing staphylococcus strain, Streptococcus pyogenes, and Staphylonemonia have limited activity against gram-negative. Inactive against Enterococci, MRSA, Listeria, monocytogenes, they are limited. And second generation of cephalosporin have a great stability against beta-lactam, active and in vitro against bacteria suspected to the first generation, most in Haemophilus influenza, anaerobic gram-negative bacteria. Second generation are more active than the first. This is the major difference between the first and second. The third generation of cephalosporin have higher beta-lactam stability and expanded spectrum of activity against gram-negative. Activity in vitro, gram-negative susceptible to the first and second generation. Most are active against enterobacteria, E. coli, Klebsiella, Neisseria that may be resistant to the first and second generation. Some are active in Pseudomonas. The fourth generation more resistant to inactivate by beta-lactam, expand spectrum of activity, gram negative, more active against gram positive than most third generation. This is a special one. Inactive against MRSA, intracocci, and Listeria monogenes. These are some part of cephalosporin. Mechanism of bacterial resistant to cephalosporin. Resistant to the cephalosporin may be related to inability of antibiotic to reach its site of action, alteration in penicillin binding, destruction of the cephalosporin by hydrolyzing of the beta-lactam ring by beta-lactamase. Adverse drugs. Some of the adverse drug reaction of this cephalosporin are hypersensitivity like anaphylaxis, bronchospasm, urticaria, and cross-reactive with the penicillin allergy in 20%, nephrotoxic toxicity, diarrhea, disulfiram-like reaction. They may be leads. Therapeutics of this drug are skin and soft tissue infection due to Staphylococcus aureus, Staphylococcus pyogenes in the first generation, colorectal surgery where prophylaxis for intestinal anaerobic desired second generation, and generally second generation displaced by third generation. Oral second generation can be used to treat respiratory tract infection. Therapeutic use continued on the third generation with or without aminoglycoside, drug of choice for serious infection caused by Klebsiella, Enterobacteria, Protoseria, and Haemophilus species. Ceftriaxone is the therapeutic choice for all form of gonorrhea and for severe form of Lyme disease, but at now time ceftriaxone misusedly used. It have a broad spectrum, but most of the health professionals have been used for by its active response, but we should have not been just give ceftriaxone for all type of infection, please. Drug of choice for treatment of meningitis caused by Haemophilus influenza sensitive and pneumonia, meningitis, gram-negative enteric bacteria, treatment of pseudomonas, meningitis infection, treatment of community-acquired pneumonia, and the fourth generation empirical treatment of nosocomial infection, hospital-acquired infection. This nosocomial infection have been referred to that of hospital-acquired bacteria where antibiotic resistance or extended spectrum beta-lactamase or chromosomal induced beta-lactamase are anticipated. This is the some part of cephalosporin. I will be back on the other topic. It's the first presentation about the drug, so I will continue. Just follow me. We can to teach each other. Thank you.